there's a family who was not able to see their loved one in the hospital, and this nurse was talking with them over the phone and knew that that was very difficult for them. And she asked the question, if you could be here, if you could be in the room, what would you do? What would you do for your wife? What would you want to tell her? And I thought this was just such a meaningful question. And what the husband said, I would read it to her from this particular story and this book that they've been reading. And he also said, I would want to speak words of encouragement to her, and gave some examples of what he might say. As a chaplain, I had the opportunity to just sit with her and read to her from this book that is familiar to her, and that, even if her family cannot be present, that she can have a little bit of that normalcy. This was a way that felt familiar and personalized, in a way that we could hopefully help connect them, even if it's not in a physical way, that we could provide words of encouragement and be kind of a conduit and a vessel to be able to connect. It was also just really meaningful to see how this nurse was attending to much more than this patient's physical nature, that this nurse was also paying attention to the emotional and spiritual support that we could provide for this patient and for their family. So that was just a meaningful experience of hope and expression of that to me.